Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss a very important topic, that is fear. F-E-A-R, fear. Fear is a kind of emotion, and it is one emotion which every individual on this planet has experienced at some point of his life or another. However, when we talk about fear in psychiatry, we have to differentiate between fear which is natural and normal and fear that is abnormal or unnatural. Natural fear is because of issues where every person almost in a particular culture would feel afraid of. For example, if I see a snake close to my foot and it's a python or maybe it's a cobra and it's about to bite me, then of course I'll feel scared, and that's a normal response. Or if I see a tiger in a jungle just in front of me and it's a man-eater, it's very normal to feel scared or it's very normal to feel fear. But if I see an ant or maybe a fly and I feel afraid, if I belong to a culture where my people are used to flying in an aeroplane and I feel scared, I feel that I'm going to die when the aeroplane flies, then it's an abnormal fear or unnatural fear. We see a lot of clients and patients suffering from unnatural fear in our clinic, and the causes can be many. Sometimes when a person suffers from anxiety, especially a generalized anxiety disorder, there is a vague fear about everything. The person has low self-confidence and feels as if something bad is going to happen to him. His mind is full of pessimistic thoughts, and he cannot correct these thoughts despite trying very hard. So it is a sign of generalized anxiety disorder. Another type of fear is when the person feels afraid of a specific situation or a thing. Let's say the person feels afraid of a spider, or the person feels afraid of the lift, of going up in a building in a lift. The person feels afraid of flying in an aircraft. So these are specific, fears to a specific situation or to a specific thing, and it is called specific phobia. Apart from that, sometimes fear may be of a different type. The person may be afraid that people are against him, are conspiring against him and are trying to harm him. So that is called paranoia, and that's a sign of psychosis. Psychosis again can be of various types. It can be schizophrenia, it can be delusional disorder, or any other form of psychosis. Sometimes a person who's used to or who's addicted to a particular psychoactive substance, and if he stops using the substance suddenly, he has withdrawal symptoms, and one of the withdrawal symptoms can be fear. And here the person, for example, I would like to give the example of alcohol withdrawal. When a person is drinking every day and he suddenly stops drinking, he goes into a withdrawal state when he might be afraid that people are chasing him and people are trying to harm him. So that is actually a withdrawal state. And once that withdrawal is treated, the fear goes away. Apart from that, fear can be a part of anxiety, anxious personality disorder, where a child is brought up in a very protected environment, and when a child is criticized all the time, and whatever good he does, he's never appreciated, he's always criticized. So that way a child never develops self-worth, self-esteem, self-respect, and grows up to develop something called an anxious personality disorder, and where the child will be afraid of almost anything and everything which is considered normal for that culture and for that age group. So fear can happen because of different causes, and once we find a client who's afraid, especially in situations where his family members or his community people or his people from his age group are not afraid, we think that it's abnormal, and then we find out the cause of this fear. And once the cause is identified, we can treat the person effectively with medications and non-medical practices like psychotherapy and counseling. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, take care.